to this breakout session of the 2025 Culture of Data Conference. I'm Allison Rosenthal. I use she, her pronouns, and I'll be moderating this session. I also have Peggy Jarrett, she, her pronouns as well, who is managing the Zoom and is making sure the tech is running smoothly. You're all muted now, but if you have a question during the Q&A session, please feel free to unmute. And then if you have a question during the session, please feel free to use the chat because we'll get to those later during the session. And if you are able to put your pronouns in your Zoom profile, you can easily do that by going to your profile picture, and then on the top right corner, there's like the three dot button. And if you click rename, you should be able to add those to your name. And then in today's session, we have one presentation. The presentation will last for they'll present for approximately 25 minutes, and then there will be 10 minutes for questions afterward. And today's presenter is Jim Kimmerly, who's going to present on leveraging data science to address behavioral health inequities, social determinants of health in Northeast Colorado. And I'm just really excited that Jim is here to present and provide this information about looking at like some regional health differences and specifications for this part of Colorado. Yeah, we really love to have these types of presentations at the Culture of Data Conference. So with that, Jim, take it away.
Well, good morning, everybody. Again, my name is Jim Kimmerly, and I am fortunate to say that I work for Colorado State University. I work within our engagement program. Within engagement, I am a regional behavioral health specialist working in our eastern region, which is our Eastern Plains. My office is based out of Sterling. If you all may know where that is, along Interstate 76. And my region is consisted of 10 counties in the Northeast, and I call it my 17,000 square miles of fun because depending on the season, it may not be the easiest part of the state to navigate for sure. Here we go. If we can go next slide. So with the work I do within extension, the roles are new. It's a position that has only been in existence for not quite 2 years. Started July of 23. Yeah, that's right. Holy cow, time's going by fast. So really, the work that has been done is all groundbreaking, all brand new. Within extension, there's a variety of staff, regional specialists across all kinds of different specialties, different kind of agricultural specialists, folks that specialize in community and economic development, education, health. There's just a myriad of us. And then we have our colleagues that work at the county level. There had never been until almost 2 years ago, regional specialists that focused on behavioral health needs. And clearly, it had been recognized by not only the Board of Governors within CSU, the administration within the university, but also the state as well, creating this partnership that brought all of us on. So, it's been, some days have been challenging, as you can imagine. I've lived and worked out here in Northeast Colorado for a good number of years now. And so I had been fortunate to be able to take this opportunity where I've worked for a while now, and knowing where those challenges are, and just being a good old-fashioned clinical social worker that likes data too much, it became a great opportunity with a relationship with the university and the work on the ground, because I laugh every time I look at my university ID, it says faculty, because technically I have a field-based faculty appointment within the university. So it brings all my passions together, trying to make a difference. And the work we've been trying to do really tries to blend bringing the data to drive where our needs are, because I could go in any million different directions in trying to do things, but being able to utilize data, being able to utilize social determinants of health have really been helpful for me in guiding my work on the Eastern Plains of really trying to tackle and address some really challenging needs, and particularly with the first 4 months of this year have been made even more challenging. So I'll try to describe quickly, the method to my madness of how I'm trying to divide and conquer the needs across the plains, and doing that, you know, driving that process myself, but doing that with a variety of community stakeholders, because certainly I wouldn't get far if it was just me trying to drive the bus everywhere. Next slide. So again, like I said, I had a number of years of experience before coming over to this role, and sometimes I do joke because I most of my 30 plus year career I've worked in community mental health, usually in frontier or rural communities. And so when I had the opportunity to work at CSU, I was excited about the opportunity because I felt I had the opportunity to be a part of the solution, a chance to um, really work on some of the things that we've struggled with and really just didn't have the opportunity to make much progress on. Can we advance one more? Okay. So the areas that, granted, like I said, there's only one in me, and one in me facilitating multiple types of initiatives, but broke it up into these five: healthcare access and quality, economic stability, education access and quality, social and community context, and neighborhood and built environment. Next, please. So if we go through each of these just a little bit, because I think it's important to understand the context of each of the five. The challenges with healthcare is the limited availability of providers, particularly if we look within the mental health and behavioral health field, very much struggling. I'm an unusual bird of being an LCSW out here in Northeast Colorado. There's just not very many of us. And it limits how we can deliver services, access the services, it delays services. One of the things that has evolved and certainly have pushed and advocated for this, and because I've managed these type of programs before, are integrated healthcare programs. And right now we have three different primary care providers that are each looking for a licensed behavioral health provider. And there are none to come by. So we'll talk a little bit about that in a bit. Long distances to travel. There are a variety of small rural community hospitals, and attached to most of those hospitals are also a primary care clinic. And if the hospital did not run the primary care clinic, we would not have primary care in most of our counties. Multiple times, I come across individuals that have a unique, specialized medical need, and they have a couple-hour trip one way to the front range. So it becomes challenging, in particular, like I said, with the specialists, whether it's dental or vision or geriatrics. I help to facilitate a Parkinson's support group, as well as an Alzheimer's support group. And so many of our folks have to travel out of the region to get the care they need. Another issue is underinsurance and no insurance, particularly when we look at our agricultural workers and our older adults. One of the things that makes Northeast Colorado really unique from an agricultural perspective is that when you look at what kind of ag we do, it's production. It's a large scale. So when you look at the top 10 ag producing counties in Colorado, they're all in Northeast Colorado. That is what we do. There is really not a great diversity of employment. So oftentimes when folks ask me to describe it, I go, it's ag or it's ag. And pretty much, true through most of our counties to some degree. Next slide. again, part of the challenge here is, why does this matter? It's been a long struggle for Colorado, and you see different sets of data that we're in the top 10 somewhere of deaths by suicide, and certainly when you start drilling down on the data, that the numbers are higher in rural and frontier communities, and then if you drill down a little further, it's even higher within our farming and ranching communities. So it's a challenge of addressing a diversity of needs, whether it's farmers or youth or older adults, but ultimately have the ultimate goal of making more resilient communities. Next, please. Economic stability. There are, and I have some slides and a little bit of data to bore you with in a little bit. But generally, we do have higher rates of poverty in our rural communities. Employment, as I said earlier, really is not very diversified. It is very much agricultural based, and it can be limiting. So it contributes to the out-migration in many of our communities of our youth, that many of them are excited to graduate and be gone as quick as possible. And then on top of it, like we're seeing in many parts of the state, we have some hidden pockets of significant food insecurity as well. Next slide. Educational access. Across my 10-county region, there are 37 school districts. I joke around that we still have the one-room schoolhouse, but it's a one-building schoolhouse because it'll be a big building in town that has everything from K to 12 in one place. And there can and are schools, districts across the Northeast that have 100 or less students. So it becomes quite challenging all over the region. Despite having a community college in Sterling, access to higher education can be challenging. I also throw in Morgan County, we also have access to Morgan Community College as well, but we don't have a high percentage of individuals in our region with degrees. And also that leads to the challenge of that we have fewer behavioral health professionals, despite multiple initiatives that have come out of the legislature over the last couple of years and in partnership with the state community college system. Our rural community colleges have been very reluctant to implement a lot of those different programs, or whether they're the micro credentials or the degree programs that are coming out, just don't see the vision or need for those. So we'll talk a little bit of different efforts we've tried to work on, and a direction we're headed in that, knock on wood, hopefully in time will start to show some dividends. Next slide. Social and community context. The one thing, throughout the region, I can say through all of our small farming and ranching towns, is that we have strong social ties and neighbor support. I live in a little town called Akron, town of 1,800 people, if you're lucky, Washington County, about 4,800 people. So, very small. Everybody knows everybody and has that tie, that connection. But at the same time, there is that challenge and that stigma around mental health and substance use. I've been working for the past year plus in one of our counties who had a significant spike in their death by suicide rate last year. And the first 3 months of the year, they saw the same number of deaths they saw in the entire calendar year of 23. So through the end of March, I had 11 deaths by suicide, which was equal to the same number they had all of 23. And when we started looking, and again, using data, also noticed that in this particular county, within the 10-county region, they also had the highest overdose rate. And there was great reluctance to deal with the SUD issue and overdose versus mental health and suicide, which totally caught me off guard. But but ongoing conversations and dialogues and building those coalitions, it's an ongoing effort. Isolation, particularly with our older adults and individuals with disability. Oftentimes folks think that, the nearest neighbor can be a mile and a half away. That's true. But isolation does exist even within Sterling. A town of about 13,000 people, that there are pockets of folks that are isolated for a variety of reasons. We know the variety of challenges that provides and presents because of that. And then limited culturally competent services. We do not, from a behavioral health perspective, have any bilingual providers. So we'll be talking about a little bit, a couple slides about some health equity work I have going on to address that issue. Next slide. Neighborhood and built environment. One of the most significant challenges around is lack of public transportation. There is a public transportation system in the city of Sterling, but it's very limited and does not necessarily take people where they need to. And again, lack of resources of being able to make that any better than it is. Earlier I talked about folks that have to travel out of the region to access specialty medical care. A lot of folks do limit what appointments they go to because they do not have the financial resources to be able to do that. Inadequate or affordable housing, and I put a note in here, particularly with folks in recovery or reentry. Significant challenges for those populations, because I think back, many years ago, I don't know if I could come up with the requirement that many of our landlords have of 3 months of rent up front. That is a whole lot of money for anybody, particularly if they're in recovery, trying to find a job. Oftentimes it's not a well-paying job, or folks are coming out of the criminal justice system, face a great amount of stigma of who would want to employ them. So there's some significant challenges. Across the region, we don't have the largest or the best rental market, which then really puts the pressure on other types of housing, and it just log jams everything. And we'll talk a little bit about that later. Limited internet and broadband. Things are slowly, gradually improving. I would say the one thing about telehealth tends to be, unfortunately, I think, the answer to fix all of our problems with our healthcare provider shortage. But at the same time, there are very large pockets of resistance because of the quality of the telehealth care folks have had access to. So that limits that as well. And then finally, environmental health concerns, particularly pesticide exposure, water quality, with the Parkinson support group that I referred to earlier. Many of the men that come to that group are retired farmers and ranchers. And that connection between pesticide exposure and farming and ranching is growing stronger and stronger. And you just need to attend one of those groups a month to really see how many farmers and ranchers are struggling. So time will tell how strong that connection is between the two, but I can tell you out here, there is strong belief that there's a correlation between exposure and the development of Parkinson's. Next. Okay, now to bore you with some data. I always like to, with different groups I'm trying to bring together around different types of need, really try to present why is this important. And certainly wanted to share a little bit with you the things I've put together for a variety of different needs. And this one examines the poverty rate. And if you look at the poverty rate, it's slightly below 10% statewide. And you will see within the 10-county region that 8 of 10 are above that, and some significantly. Elbert County is significantly below because it's an odd it's situated in an odd place because you have a lot of folks that are relocating there to either drive and commute to Denver or drive and commute to the Springs. So it's in this weird spot that is close to both. So particularly when you go to the far western part of the county of the city of Elizabeth, very much front range driven. Continue building out with large houses. You get 3-4 miles outside Elizabeth, it turns rural very quickly. So a lot of the data within Albert is a bit skewed because you either have that western end that influences the entire data for the rest of the county. Next slide. When looking at it, because we talked about housing, and there's a significant um, housing insecurity problem within the Northeast. And I wanted to present this one versus other data because our data that gets presented from our school districts to our point in time studies don't correlate with each other. So I have to really work and focus with folks of figuring out how we're reporting totally two different numbers. And the numbers that you see here, because I said a little bit ago, we have 37 school districts across the 10 counties. Now, a good portion of them have are reporting zero. So I searched and got a handful of schools that are reporting homeless students. So we have on the left the number of homeless students that have been identified, and then the orange column is the total student population. The challenging thing with this is each school year I see this number growing exponentially. The challenge is that there's almost nothing going on in this space right now to really figure out how do we stop the bleeding? How do we stop the continual growth of these numbers? So I'm hopeful with some things that we're starting that we may be able to plug our finger in the hole and turn these numbers around. Next slide. Couple of slides on really mental health challenges that we face out here. Granted, we've talked about the shortage of providers and challenges within stigma, that challenges within the farm and ranching community, that it's not an accepted norm to ask for help. So there's a variety of different things we're trying to challenge with that, but just wanted to give a good visual. And these next few slides are broken up actually into two projects I have going on that we'll talk about a little bit. But you can see any of the counties that are over 20 per 100,000 are outliers, and certainly some stick out more than others. Next slide. Again, same set of data, but for the rest of the 10 counties, these are 4 counties, and like I said, I'll explain that in a little bit. But you see, that some of the significant challenges that we're facing when it comes to dealing with a mental health crisis out here. Next slide. The last piece of data that I thought was important to really paint a picture of the challenges we're facing, not only with economics and with health access and equity, is within the number of county residents receiving Medicaid. You can see the state rate is at 18%. Again, Albert being that weird kind of combo mismatched county of urban/rural, but you see the numbers for the rest of the 9 counties are significantly higher than that 18%. Next slide. Okay, so what next? Being able to utilize the data that we have access to, because certainly there's a lot of data that I don't, but have asked different state departments on, and folks agreed that it would be important for planning processes and to have that information with the community. So a couple of things that we're doing is this past January, we received 2 grants to implement suicide prevention coalitions across Colorado. That's why those 2 slides on death by suicide rate were divided in the counties that they are. the funding source had split my 10 counties into 2 regions, one of 6 and one of 4. So we've been working towards implementing different committees to look at what are going to be our different strategies, hopefully in the long term, longitudinally, to start making a difference. Also received a grant to start addressing health equity issues that exist in Northeast Colorado. We started off with behavioral health prevention as an initiative, primarily because I found a grant that would fund this initiative, and the goal of it was, first part of the goal was to get 2 bilingual individuals to deliver mental health first aid, the adult course in Spanish. And then, the second part would be then developing access to therapeutic services, therapy. But unfortunately, that grant is on hold. So we're trying to figure out our ways around that and navigate where other funding sources might be. This summer, I was fortunate that each summer extension has a summer internship program that it's available to all CSU students. So this summer, I'm going to be working with 2 bilingual students that are going to be working across the region to conduct a needs assessment and environmental scan with our migrant farm workers. We have a really good connection with that community and done a variety of different programs through the last particularly 2 to 3 years. So we're very optimistic that through the course of the summer that we're going to be able to get some good information and being able to come up with next steps of how we can triage that. And then lastly, the Housing Coalition. There's a variety of community stakeholders that have come together over the past year to start addressing this. This group is very different and unique because normally through a community housing assessment, these are folks who are not involved in the process. These are community providers. These are religious, faith-based leaders. These are individuals in need of safe and affordable housing themselves. So over the past 6 months, we've done a variety of community listening sessions for different populations, whether they're older adults or family, the unhoused, folks in recovery. We wanted to hear from a variety of different communities, understand what their challenges are, so we can take that information and then collaborate with the policymakers and decision makers to come up with a housing strategy that works for the entire community and not part of the community. Next. So what's the future look like? Keep moving forward is continuing to focus on that health equity piece. Being able to have housing stability as a priority. Looking at where our infrastructure gaps are, whether they're with technology and broadband. We talked about transportation. Childcare is huge here in Washington County. If the county commissioners was not subsidizing the childcare program or daycare program, we would not have one. Behavioral health and community integration. Continue to look at triaging the issue with stigma and isolation that exists, but also looking for ways that we can further move along the needs of the community, whether it's integrated care or whatnot. We know a lot of us have heard from the state demographer the challenges with aging, and particularly in Colorado, when rural communities were aging quicker. One particular county, Sedgwick County, has a unique challenge. A county about 2,000 people have that hollowing out that I talked about of their youth. They graduate, they go running from the high school screaming, never to come back. And yet we have retirees from the Front Range that want somewhere safer, quieter, gentler to live in. So they're selling their house and then being able to find something really nice plot of land, and pay cash for it. So Sedgwick County, like I said, being small, is aging quicker because we're losing our youth and we're having retirees move in at the same time. And then at the same time, we know that our funding from the state regarding aging services is not keeping up as our demographics change. So that's going to be a definitely uphill battle and challenge, but also continue to be able to build out the data we have, data we don't currently have access to, but trying to get access to, and use that as part of being innovative. If it's shared housing models with older adults or whatever it might be, but using data to guide us. Next. Challenges in the future, workforce shortages, talked about healthcare, construction, obviously early childhood. I have a partnership with our community colleges and CSU to do a 2+2 program where it will allow students to learn in our rural community, get their first 2 years of education at the community college, and then do the second 2 years in our first phase of this of getting their bachelor's and social work degree remotely. So the BSW program at CSU will be starting a remote component in fall of 25, and slowly, hopefully, we're going to be feeding students from Northeast Colorado through there in an effort to grow our own. Because certainly we've tried multiple things of recruiting people from out of state. They don't stick. Trying to recruit folks from the Front Range, they crave the Front Range and leave. So what's the next best thing of trying to grow our own talent? There's huge, as you can imagine, rural communities and mistrust of systems or government-led efforts. Um, I'm not sure if that will ever go away, but it's certainly something that's challenging and need to acknowledge. And certainly sustainability of grant-funded pilot projects with that long-term sustainability. Sometimes grants ask for it. A lot of times I build it into my grants of how we are going to sustain this program for the long term. That after your initial investment of 2 to 3 years, this is Jim's mad scheme of how we're going to keep this sucker going. And sometimes we can find ways. Sometimes that's a little bit more challenging, but that also is a challenge to put on our radar. Next. And that's it. Yay! Made it to the end. Certainly, is my contact information, my email. Certainly, I ran through a lot of things quick and certainly kept things brief because of a short amount of time this morning and only got to the tip of the iceberg with things. But certainly, if anybody has any questions or, want to know more information, want to chat about anything, pick my brain, reach out anytime. If I can be a resource to y'all, I'd love to do that.
Thank you so much for this presentation. Oh my gosh, I was just blown away by like how many different programs you've introduced. Yeah, I marvel at how you have time for all that. And also, are you like a provider, like a healthcare provider as well, too?
Well, yes, because
Yeah.
I can't get away from that itch of that clinical side. So within Colorado, we have something that's called CAMP. It's the Colorado Agricultural Addiction and Mental Health Program. And it's a program that's just geared towards our farm and ag community, our rural communities, that if anybody works in an ag-related field, and it's a pretty large, loose definition, can get an access for a voucher for 6 free therapy sessions. So I am one of 8 individuals that provide that therapy for our farming and ranching and agricultural community across the state. So I still dabble in that piece of it, and certainly feel a strong connection and tie to give back to my community. So it's something that I know if a farmer rancher reaches out, it's
Mhm.
pretty important.
Yeah. Awesome. Do we have any questions from the audience? Yeah, feel free to come off mute, or yeah, you're welcome to use the chat. Oh, yes, Dennis, please. Oh, I think you're on mute still.
I am on mute. Yes, I am. I
I
think I
hate when
learned,
it happens.
no matter how often. So thank you very much for passing on this information. It's wonderful and necessary. And I have to caveat this one because I want to first fully acknowledge the challenges and disparities folks are facing that you clearly outlined. I also want to make sure that you had the opportunity to talk about the things that bring the community joy and some resilience aspects and protective factors to health as well. So going to offer that. That's first part. Second part is, however you want to frame your view of the community, is there a way that we in public health, something that we can do to more equitably support your work with these deserving communities? So I'm thinking, are there maybe incentives for younger folks with certain skills that could relocate to help build out that local health and the infrastructural resources? So
No,
those are my
thank
two.
you. No, thank you. I appreciate that. And I appreciate your first question being a strength-based type of question because that fits me very much. I think the relationship that we have with on the Latino community is because of the work we've done. We've helped them because we don't have really any organization or anything to hang their hat on. Eventually, I would love to help them create their own 501c3 long term so they can have their own organization and they can take ownership. But over years, we've helped them get financial resources, other things to start celebrating things that mean something to them. Cinco de Mayo. I forget what number we're going, 4 or 5 years now, then in Sterling, that we have this huge celebration that we bring music, we bring food trucks. Who doesn't love to eat? And we close down a part of town and just celebrate. And the whole community participates. And it's the coolest thing to see everybody embrace it. So it's not like, oh, we're doing it for part of the community and it's their celebration. No, Sterling has been very good at embracing that. And to the point that that has gone well, we do later in the year, we do a Mexican Independence Day celebration, which is even louder yet. It's even more fun. And I just love it because for me, it's an opportunity to eat because I love food. Um, and there are some great cooks in our community. Oh my gosh. And being able to support them is just wonderful. But so it's nice to see these things grow organically. And it was from that relationship of helping them build out those events that meant something important that they had actually, and I'm kind of embarrassed because I speak like really bad Spanish, of helping them build out the resources they need. I'm like, me? I'm like, there's no one else you could go to? They're like, no, we know you. We trust you. And we know because I told a group of folks in a training a couple weeks back, I said, give me 6 more months and we'll have therapy services for you. We might have to start telehealth and build it, but we build it and you will come because it is so much a hole. It's such a large deficit of, I told someone recently, I don't care what letters. This is just what's right to do. You know, I intentionally now write my grants and different things and avoid things because it's just the right thing to do. And I just get speechless every time I talk about it that they came to me and asked for help because they knew that I was going to shake the living crap out of that snow globe and we were going to get something to happen. The second question, I think it's continuing this dialogue because every time I have a conversation with folks are like, what can I do? You fired me up. Let's continue talking. Let's continue collaborating because there's a fierce sense of independence out here. And, I'm kind of, you know your crowd, you feed into the crowd of like, we can solve this on our own. We can do things creatively. I didn't get a chance to touch on it, but I got a couple projects going on with rural school districts around youth prevention and resiliency. And I'm like, oh, I'm not sure how this is going to go because we decided we were going to do a large scale needs assessment and turn it into a community needs assessment of assessing, surveying teachers, students, family members, and the community. And lo and behold, guess who bought in? Everybody. I'm like, holy moly, this is not what I expected. Blew my socks off. Even though I'm the one that suggested saying, hey, we need to take a larger view and get this community buy-in. So I think just continuing the dialogue and figuring out where those opportunities are, exchanging ideas. I mean, there's folks across the state that have heard about my 2+2 degree pipeline that are like, tell me how you did that. And I'm like, well, that was simple. Other people in the office were working on 2+2 for ag-related degrees. And I just stole the idea. So I'm like, why can't we do this with social work or psychology or counseling programs? And there is no reason I found. Everybody I've talked to, I was like, let's do it. The community colleges were wide open. Obviously, I'm cheating by doing CSU, but I'm trying to build out that relationship with UNC because they have a rural focus and within their master's in counseling program would be a great hub. So I'm not going to pick and choose saying, hey, I only want social workers out here. I want people to want to be out here. I don't care what your degree is. Together we can do this. So that's my mad scientist view of this, and I'm going to stick to it. So if you want to help, want to volunteer for stuff, find out where you can contribute, just shoot me an email. We'll figure it out.
That's wonderful. Thank you so much. I like the idea of And I understand the fierce independence you want to build within, and there's no reason in the world folks can't if you just give them the opportunity to do so. So thank you for continuing to give those opportunities.
Well, I think it's very empowering if you think about it, Dennis. Beyond having your stakeholders in the community come up with their own solutions and then embracing those solutions and hope making it happen, you have that buy-in. And then it's that contagion that just grows. And I think of the housing meetings we've been doing because, like I said, we've been doing this about a year, and a lot of I joke, but everybody will tell you it's true in Sterling that a bunch of former colleagues and coworkers bullied me into doing it because I'm like, why would I want to take on housing? Every time we talk about housing, we get squished like a bug. The community comes up and hits us over the head with NIMBY, and we get nowhere. So I'm like, okay, I'll give it a try, maybe 2 or 3 times, and everybody will go back away and leave me alone. And here we are, a year plus, and have participation from the city of Sterling, police department participation, city of Sterling sends someone, the county commissioner sends someone. Never thought we'd get this far, honestly.
That's
But
awesome.
that's that contagion.
Oh, that's really great. Yeah, these are such good calls to action. I think we might only have time for one more question. I just want to bring up Anne's question from the chat. Anne wrote, I really appreciate how connected you are to the community, Jim. You also bring up a really good point about the challenges of providing resources to aging populations in rural communities where funding is limited. Any thoughts about how we can continue to provide essential public health services while also shifting services to an aging demographic?
It's significantly challenging. Like I said earlier, it's a demographic that is just expanding quicker than we know what to do with. And there had been a piece of legislation that asked the state unit on aging to examine the adequacy of funding. So utilizing, again, state demographer data that if we continue to age at the same rate and how we're currently funding services, by 2030, we will have to increase our funding by 55%. And then I will tell you that funding is currently being cut by 12.5%. So we're going absolutely backwards. So it's utilizing those different resources because I have some great connections within AARP and been able to tap into some of their resources, some of their grant programs, some of the things we know. How can we plug in the needs? Because so many of the folks in our region want to age in place. And when we had our community listening session with older adults about housing, I asked them intentionally, can you live in where you're living in 5 to 10 years, knowing your house is going to change? And they were all questioning whether they could because their house is not accessible. They don't have different devices put in, installed in their house to be able to pull that off. But, I don't take no very easily. So just shifted the focus of looking at where other resources do exist where we can get this done because certainly with our public funding it will never be enough and probably never will be. But there's those partnerships and connections we're going to make and we're going to still plow forward, whether it's doing modifications to housing, or whether I'm determined that we're going to be able to replicate a model that exists on the Front Range of doing a shared housing model for those 55 and older. But just give me time. We'll figure it out.
Yes, I love this optimism. Yes, thank you so much for your presentation today, Jim. I feel like we have so many thoughts for further actions, and I really appreciate all the work that you're doing and sharing with us. Just a couple of closing announcements. If you want more information about the presentation, please feel free to check out SCED. We have the QR code for our evaluation for culture of data. Please fill it out so that we can get some more information about your experiences at this conference. We can make it better for next year. And we're about to have a break for lunch, and the next live session will begin at 12:30. And this is going to be new for our conference. We're doing a poster session where we will explore groundbreaking research and real-world applications of data in tackling social determinants of health. The post session will be interactive and showcases innovative projects that use data to expose inequities and drive actionable change in public health, and is another concurrent breakout. So you can look for more details about this on SCED. Thank you so much for joining us today, and hope you have a really good rest of your conference. Thanks, everyone. Bye.